is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
All right, well, good morning, everybody. This kind of ties into what Kelsey was talking about, people wearing all sorts of different color scrubs and tops and everything. So I think everyone's probably noticed that a lot less physicians wear white coats now than they used to. I think a lot of people think that even though they are maybe a symbol of professionalism, they're probably antiquated and dirty and, carry communicable nosocomial infections on them. So most physicians probably don't wear them. So, a lot of people have kind of started wearing fleece tops and soft shells, and it's not just a Colorado thing. It's, pretty much a national thing. Now we see like all our cardiologists wearing Patagonia and Stio and all sorts of stuff embroidered with their names and professions. So it's definitely replaced the white coats. And there was an interesting study that kind of looked at patient perceptions, specifically of white coat versus fleece tops versus soft shell. So that was kind of interesting to break that down. And this was done about 500 people who aren't physicians or medical providers answered. And what they did was they showed them pictures of models from the neck down wearing different combinations of white coats, jackets, scrubs, professional attire underneath. And what was interesting was, not surprisingly, people thought that white coats made people more professional, more experienced than, more casual jackets. Interesting thing about that is if you do look around, probably some of the few people who still wear white coats are like interns and residents around here, but patients might still think that they are the most experienced people. And then another interesting was looking at female physicians. People thought that they were less likely to be professional and less likely to actually be physicians, no matter kind of what they were wearing. So I think, it doesn't go to the fact that we need to go back to wearing white coats, but just like Kelsey was saying, introducing ourselves, kind of being very clear about who we are, maybe even, how long we've been at Swedish, what our experience is, that probably goes a long way for patient experience and kind of reiterating our roles and what we do, and just kind of an interesting idea of what patients perceive still. Another interesting, not surprisingly, is that older respondents tended to think more that white coats were important and show professionalism. So kind of if you're old school, you probably even need kind of more reminding of who's who and what people's roles are.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.